Let's continue this discussion on dengue in 2024. We mentioned 2023 as well. What's happening? Currently, 90 countries have known active dengue transmission in 2024, not all of which have been captured in formal reporting. As we said, there's definitely underestimation. In addition, many endemic countries do not have strong detection and reporting mechanisms, so the true burden of dengue globally is underestimated, as we said already. In order to control transmission more effectively, real-time robust dengue surveillance is needed to address concerns about the potential undetected cases, co-circulation and misdiagnosis as other arboviruses and unrecorded travel movements. I'm reading this because I read the executive summary and then some of that gets reported in the main text. I'm skipping many sections, but I'm just emphasizing few of these things. These factors could contribute to unrecognized disease spread and establish a potential risk for local transmission in local endemic countries. So there is a dashboard that who provides to read a bit more about the data to strengthen global surveillance and monitor temporal trends and disease incidents, who has established a global dengue surveillance system with monthly reporting across all WHO regions, which is now available as a dashboard. So this is a link that you can click on from the report. This has so far captured 103 countries, as we'll see, including 28 zero reporting countries. No autochthonous or locally transmitted dengue cases have been reported in Europe so far in 2024, but these data will be added when autochthonous cases occur, which can occur when seasonal conditions permit vector activity from June to September. This report was written on May 30th, so obviously it will come up soon. Given the current scale of the dengue outbreaks, the potential risk of further international spread and complexity of factors impacting transmission, the overall risk at the global level is still assessed as high, and thus dengue remains a global threat to public health. So here is some data. Epidemic curve of dengue cases and deaths as reported to WHO from January to April 24 before the report was written. So this is the date of notification, number of cases. These are in hundreds of thousands, so 2,500,000 is the max number here, and you can see the global dengue surveillance system is still under development, so not all countries are reflected in this page. So this is from January to April. You can see it peaked in March and then has shown a slight dip, but with Europe becoming active, it obviously will pick up, and we'll see if that data comes out soon. Number of deaths again peaked in March, and this is in hundreds, so this is a maximum of 1,500 here. So these are typically per 100,000, so you have to be careful. It's not as small as we already mentioned. So the note here is that this includes 103 countries so far integrated in the WHO global surveillance, 28 of which have submitted zero reports to date. So just because they are signed up doesn't mean they do comply with the reporting requirements. So here is the geographical distribution of dengue cases as reported to WHO from January to April 2024. US has, so these are the numbers here that you can go and read more carefully. It's illegible here, but again, this is number of cases. You can read the detailed labels, but darker colors are more than 10,000 here. So you can see India definitely is underestimated, I suspect, because I'm reading a lot about it here. There are some hotspots here, and China has Southeast Asia, Australia, and so on. So people are moving around, and temperatures are warming, mosquito ranges are increasing, and of course people from endemic countries move and then create transmission within the US, for example, even though dengue may not be autochthonous for the US. Again, more illegible graph, but this is about countries, territories, or areas with previous or current local mosquito-borne transmission of more than one Aedes-borne virus. So there are many diseases going around that are vector-borne. So dengue, chikungunya, and Zika as of 30th April. US shows up here. The Canada, no documented cases. Lots of no documented cases here, but you can again see these are the magenta color here is chikungunya only, and the green ones are two of the three vectors considered here, and transmission of all three viruses in these bluish colors. And dengue is the only disease when you have this what color is this? This is some kind of purplish color, I would say. Okay, so now India shows up here as a combination of all three viruses, even though it shows up as Sri Lanka shows up here, but not India in terms of dengue cases during that season. Okay, March, April, May is a hot season for India, very humid as well, so I won't be surprised if it's just underreported. What is the epidemiology of dengue? Dengue virus is transmitted to humans through the bite of infected mosquitoes, typically in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. Primary vectors that transmit the disease are Aedes aegypti and to a lesser extent Aedes albopictus mosquitoes, though in some regions such as Europe and North America, the latter vector albopictus is Aedes albopictus is more widespread. Monitoring of the global dengue situation to date has shown that several factors are associated with an increasing risk of dengue epidemics becoming more extensive and less predictable. And these factors include changing distribution of the Aedes aegypti vector with warming, vegetation, precipitation, humidity, temperature, urbanization and human activities fostering conducive environments for vector-host interactions. Typically in urbanizations you have so-called formal settlements where a lot of outside water bodies are available, or maybe even urban parks, green areas increase habitats for mosquitoes. Climate change induced shifts in weather patterns, fragile healthcare systems amidst political and financial instabilities, changes in the predominant circulating serotypes and co-circulation of multiple dengue serotypes. You can go and read more about serotypes elsewhere. Challenges in clinical diagnosis, particularly in areas with co-circulation of other arboviruses. Inadequate laboratory and testing capacity, prolonged ongoing concurrent outbreaks including COVID-19, which is still very active in the US for example and elsewhere, lack of specific treatment for dengue, doesn't have a vaccine or anything yet, lack of engagement and mobilization of local communities in vector control. So if you kill mosquitoes you prevent the spread because it doesn't jump from people to people. Insufficient vector surveillance and control capacities, lack of coordination among stakeholders, chronic underfunding and low donor interest in dengue, lack of involvement of government sectors responsible for addressing social determinants such as implementation of policies aimed at improving conditions related to the risk of transmission such as urban planning, water and sanitation provisions, solid waste management, housing improvement, etc. So there is a lower frequency resilience building that has to happen, and those are chronically either suffering from lack of policy or under funding. Lack of engagement and mobilization of local communities in vector control activities. Insufficient preparedness for the scale of the epidemic and low capacity for dengue patient clinical management. The more people you have who are affected, the more the chance for mosquitoes to spread them as the mosquito season arrives. Just to add a bit more, there is genetic activity going on. So we said no cure, but there are some cute studies on genetically modified mosquitoes. So it's the article from NY Times, New York Times, that says the gamble: can genetically modified mosquitoes end disease? So you have normal genetic modification where a modified gene is added to only one chromosome, so wild mosquito chromosome, and you modified the gene, and modified gene has a roughly 50% chance of being passed on to the next generation. So once you put in a piece in the chromosome, wild mosquitoes begin to assimilate the modified genome chromosome via breeding with modified mosquitoes, even if the modified mosquito mosquitoes mate frequently with wild mosquitoes, many of their offspring will not carry the modified gene. Okay, so gene drive inheritance, this is another way where a modified gene is added to one chromosome, copies itself onto other chromosomes. So you have wild mosquitoes, modified gene added to one chromosome which is copied to the other chromosome, and here modified gene has a nearly 100% chance of being passed on to the next generations. This is a detail about how sexual reproduction works, how the diploid chromosomes split into haploid chromosomes into gametes, sperms and eggs. So how it gets transmitted depends on whether both X and Y chromosomes are, am I saying it right? If both chromosomes are carrying it as opposed to just one. Okay, so here if the modified mosquitoes mate with the wild mosquitoes enough, scientists hope the entire mosquito population could change within several generations, possibly within a few months, because mosquitoes have a life cycle of 4 to 10 days. So here is some data. This is from Medellin Health Secretariat and the World Mosquito Program from Eleanor Lutz, which looks at data from 2010 to 2022. So 120 monthly dengue cases per 100,000 as of June 2010, and you had another explosion. So there was 2009 was El Nino, maybe Central Pacific El Nino, you have to check it out. 2016, of course, 2015-16 El Nino, and then you haven't had an explosion so far. Of course 2023-24 was a big El Nino here. So mosquito release began in 2017. 2021 was expected to be a peak year based on all the habitat parameters for mosquitoes and so on. But the peak didn't happen. Is that related to the genetically modified mosquitoes? There are other evidences for malaria and so on as well from Indonesia and South America, which confirm that other ways of modifying mosquitoes by injecting them with the Wolbachia bacteria, for example, reduced malaria transmissions. I think you can check out. So there are many methodologies being tried to deal with these kind of outbreaks and the mosquito population by controlling them, as well as modifying genetically the mosquitoes so that they become ineffective in transmitting dengue or malaria or whatever. So is this a Frankenstein experiment? Well, so far it's not clear, but every time we tinker with something, we always have unintended consequences, so you can keep an eye on that. Okay, so I basically took the report and made it very brief. There is a lot of new data and reports coming out that you can follow up on, but this is a topic that's worth reporting, and by the time I post this, it's going to be a few months later. So if there is any new data by the time I post it, I will report it. Okay.